So I think we're going to make a start now. I just want to say welcome everyone and thanks for coming to the 7th weekly economics briefing. My name is Becky and I work for the New Economics Foundation, or NEF. For those who don't know, NEF, it's a think tank working to build a new economy for people and planet. So yeah, this is the 7th weekly economics briefing and we're going to look at social care and coronavirus. So I'm excited to say that we've got 114 people on the call so far. Thank you to everyone who's joined, and yeah, if you'd like to put your name and where you're calling from in the chat, that would be great. Also, if you're enjoying the briefing, then do let us know. You can tweet about it with the hashtag #NEFbriefing to help spread the word. Just to say that after this week's briefing, we will be taking a short break to take stock and think about what we want to do next. But don't worry, we'll be back very soon. Make sure you are signed up to NEF's mailing list to ensure you stay in the loop. We'll post a link in the chat now. So as soon as this briefing ends, millions of us around the country will stand in streets or lean out of our windows to clap for carers. But what is the reality of social care at the moment? It's becoming widely documented that coronavirus is exposing the devastating consequences of a sector built on precarious and low-paid work. Many carers are on 0-hour contracts and paid below the real living wage. If they fall ill, they face the impossible choice between staying home and not receiving the income they need for rent or buying food, or they have to go into work and potentially pass on the virus. So this, on top of inadequate access to testing, PPE, other means of controlling the spread of the virus, it's had deadly consequences. There have been 22,000 excess deaths in care homes during the pandemic. This is roughly a third of all recorded deaths. Care workers too are dying at a rate double that of the general population. And these, of course, are not just numbers, but people's loved ones, family members, and friends. So how do we get to this point? And what are care workers demanding now, and how can we support them? What could a better social care system look like, building out from the wreckage of coronavirus? To talk us through this and more this evening, we have 5 excellent speakers. So first, we're going to hear from NEF's very own Head of Social Policy, Sarah Bedford. Sarah will talk about the state of care work before coronavirus and how coronavirus has exposed structural problems in the social care system. Then we'll be hearing from Unison organiser Conor McGurran. Conor will talk about the experience of care workers and what we can do to support their short and long-term demands. And then we're going to hear from 2 speakers, founder of Equal Care Co-op, Emma Back, and care and support worker, Jenny Daglish. Emma is going to be talking about her experience as a practitioner of ethical social care, and Jenny will talk about her experience as a care worker before and during the pandemic. And then finally, we'll be looking to the future, and we'll be hearing from Professor of Economics at the Open University and Coordinator for the Policy Advisory Group of the Women's Budget Group, Sue Himmelweit. Sue will talk to us about how we can put care at the centre of our economic recovery to this crisis. Now, this briefing is just a small part of a broader conversation NEF will be having about social care in the coming months. We'll be looking at care as an essential public service and involving people whose expertise comes from both using care services as well as working for them. So do stay tuned for more. As ever, while the speakers are talking, please post any questions you have for them in the chat box, and we'll do our best to ask them. We're aiming to finish before 8 p.m. This evening in time to clap for our carers, so I'm really sorry if we don't have time to get to your question. Great, so we're going to start with our first speaker. We're going to go to Head of Social Policy at NEF, Sarah Bedford. Sarah, thank you so much for joining us tonight. Would you be able to give us a picture of what care work was like before coronavirus, and why has the social care system been especially vulnerable to the pandemic?
Thanks, Becky. Yeah, I'll just talk briefly, first of all, about what care work is. So I generally describe it as a form of support that helps people to live well and to live independently, regardless of age or disability. And it's both done formally through the provision of social care, but also informally by millions of people across the country supporting others, often family members. And I'm going to talk specifically about formal care work, which is paid care work. So I think the first thing to say is that the social care workforce is huge. I think this often surprises people. It's made up of 1.5 million people, so it's even bigger than the NHS. And these are predominantly women, many are women of colour, and 1 in 5 are migrants. And as you were saying, Becky, their jobs are generally very precarious. So hourly pay on average in the sector is below the real living wage. A lot of care workers are on 0 hours contracts, and turnover is really high. And this all goes completely against the grain of a service that is fundamentally at its heart about well-being. And for any policymaker who is concerned about well-being, and therefore also concerned about other things like poverty and insecurity and inequality, then improving the quality of jobs in social care should be a priority in and of itself. But we've also seen over the past couple of months how fragile social care can be when the workforce isn't treated well. And I think, as you were saying, Becky, one of the reasons why coronavirus has spread so far and so fast in care homes, but also, and this has received less profile, I think, in the media, but there's increasing evidence that it's also spread among people receiving support in their own homes, is because we haven't done enough to protect care workers. And as well as PPE and testing, this is about basic protections like full sick pay, so that care workers who fall ill or who have to self-isolate aren't forced to make impossible decisions between struggling to get by on statutory sick pay, which is just £95 a week, or continuing to work even if they've come into contact with the virus and they're risking people's lives, including their own lives. And this is the general picture, but of course, when you dig down, you find that job quality varies in social care. And there are organisations that are trying to do things differently. I know that Emma and Jenny will speak to that when they talk about Equal Care Co-op, trying to make material improvements to pay and working conditions, but also trying more fundamentally to change power dynamics in social care. Structures in social care can be very hierarchical. Care workers get told what to do. In home care, this often involves a schedule of rush visits to people's homes. And in these conditions, the support itself can be very top down, with people at the receiving end feeling like they don't have much control. So approaches that are different to the norm and that try to share power and to give more autonomy to care workers, and help them then to go on and make decisions as equals with the people that they support, are really important. But the system that we've got at the moment doesn't favour these ways of working. Social care is delivered by a market. There's around 20,000 providers in the market, and local authorities have a statutory duty to shape the market and also to develop the workforce, but their influence is limited. Partly because we're very far from having social care that's universal and free at the point of need. So a lot of care is paid for by individuals rather than funded by the state. But also in practice, local authorities tend to award contracts to providers through a process of competitive tendering. And, you know, because they've been under constant pressure from central government over the past 10 years to make cuts to their spending, this process can often be short-termist and cost-driven, in which case it can create a race to the bottom with providers trying to undercut each other on cost, and can also favour big chain companies whose business models are well suited to competitive tendering, which then increases the precarity of care worker jobs, and also makes it hard for care workers to provide care well. I do think, on a more positive note, that there are reasons to be hopeful that things will change. One thing that's been really positive is that we've seen a surge in union membership recently among public service workers and others. And I think that's significant because union membership is quite low in social care, especially when you compare it to the NHS. Something else as well is that I think public attitudes towards care work are shifting, and it's now increasingly being talked about and recognised as essential. And then finally, I think as well that with 22,000 people having died in care homes because of the pandemic, there's going to be huge pressure on the government to come through and fulfil this promise that they've made that they will fix social care. And that pressure isn't going away anytime soon. Growing numbers of people need care. To provide it, we'll have to invest in care. And we'll also need to recruit more people into the workforce. At the moment, there are around 120,000 vacancies in the sector that providers can't fill, which goes to show that with the working conditions we've got at the moment, social care isn't sustainable. And some of these problems, I think, have obvious solutions. It's a no-brainer that care workers should be paid higher wages, and we need more public funding to make that happen. I think it's also a no-brainer that we should value migrant care workers just as much as we value other care workers. The government scrapping the NHS surcharge for migrant care workers today is a positive sign, but I think equally they should rethink their immigration bill, which shuts the doors to thousands of people who might otherwise come to the UK and work in care. And then I also think there's a more complex set of questions about the future of social care, which are less straightforward. So as more of us need care, you know, what kinds of support do we actually think it's important for us as a society to provide for each other? And how can we organise this support so it's available and accountable to everyone who needs it? And then what kind of job roles should we be creating as part of that? And these questions are complicated, but I think they're really important to address if we're going to build a future for social care that we want. So I'll stop there because my 5 minutes is up and I don't want to take up too much time.
Thank you so much, Sarah. That was a great insight into the story of social care so far, and it's good to include some positives in there as well, so thank you. For everyone watching, if you would like, you can check out the episode of the Weekly Economics podcast that we've recorded with Sarah on social care last week. Here you can find a longer discussion about these issues. We're going to put a link for that and other further reading on social care from Neff in the chat now. Sarah, we've just got a follow-up question for you from Anne. She says, I'm a disabled person receiving social care budget, which provides me with 24-hour support and funding from continuing healthcare funding. Many local authorities are putting charges up, so disabled people are having to choose whether to eat or receive care. How do you think social care should be funded, and what would you do about charging?
Well, I think that's a really good question, and I think it's a really timely question as well, because the government, as part of this promise to fix social care, you know, a lot of that has been around this question of funding, which, you know, we're very far from having something that looks like a sustainable funding settlement in social care. And I think the goal of that funding settlement has to be to ensure that support is available to everyone who needs it. And I think that we should and we can be setting out to make supports available free at the point of need, you know, on the same principle as the NHS. You know, there's been research done by the King's Fund and others sort of estimating the cost of providing free personal care, for instance, and it's you know, when you look at the kind of proportion of GDP that they're talking about, it's not hugely significant, and particularly when we are so far at the moment from having a social care system that provides people with the support that they want. I'm always really struck by the figure that Age UK cite from their survey research about how, you know, 1.5 million older people in England are living without with unmet care needs, not getting the support that they want. So I think that the goal of a new funding settlement has to be to shift towards a more universal system where we're pooling risk rather than expecting individuals to bear that risk themselves, as you were talking about, and investing in social care together.
Great, thanks so much, Sarah. That was great. So we might take some more questions at the end, but we'd like to move on to our next speaker just to make sure we get on to everyone. So our next speaker is Unison organiser Conor McGurran. Conor, welcome to the call. So you've been organising with care workers since before the crisis began. Can you tell us more about the experience of care workers right now what they are calling for in the short and long term, and what we can do to support them.
Brilliant. Well, thank you very much for having me on this vital discussion. So yeah, we have been organising care workers for the last few years, but even before the pandemic hit, and the pandemic has really exposed the failings of a system which is unable to provide the most basic protection for a lot of elderly and vulnerable people, and provides very little protection for care workers themselves as well. So based on our prior organising work, we knew that social care would be the front line of the pandemic, really, and Sarah has explained the reasons why. So on the day of the lockdown, we launched our Care Workers versus COVID-19 campaign, and we surveyed 2,800 care workers in the Northwest, and 80% said that they were scared that they would not receive normal pay if they had to self-isolate or shield due to coronavirus. Instead, they'd receive either £95 per week statutory sick pay or less. And full sick pay was by far the main thing that they wanted their employer to do to improve things during the pandemic. Large numbers said that their employer wasn't doing enough to protect either service users or care workers themselves. So on the back of this survey, we formed a campaign with 4 key demands. So the first was to protect the health of care workers through adequate testing and PPE. The second was to protect their pay through full normal sick pay, as I've mentioned, around COVID-related sickness and shielding absence. Thirdly was to protect their employment, so nobody should be dismissed or laid off for needing to self-isolate or shield. And finally, to protect their family, so carers leave for care workers who needed to care for vulnerable family members who might be needing to shield due to coronavirus. So sick pay has really become the key battleground issue in the Northwest, at least. And if you were looking to design a system to spread COVID to the elderly and vulnerable, then failing to provide adequate PPE and adequate sick pay for shielding for care workers would be a good starting point. So one of the quotes in our survey was, "I am concerned that if you get coronavirus, you don't get paid. One of my colleagues tested positive, but came back to work early as they are under financial pressure. They were still ill with symptoms and had to go off sick again. 2 members of staff who live alone have struggled with bills because they had to go off on SSP." Academics, led by Professor Lydia Hayes, analysed our survey results, and the key ask of the government that they came back with was to guarantee full sick pay for care workers in order to stop the spread of the virus. And we knew early on that poverty would force some care workers to continue to work when they should be shielding or self-isolating, and that is exactly what's happened, unfortunately. And it does partially explain why some social care settings are now seeing so many outbreaks of COVID. So our campaign has had some great results so far. We didn't take our demands to employers, but rather took them to councils who outsource these services. Care workers in Merseyside have won over £20 million of additional funding from their councils to match our campaign demands. And just under half of councils in the Northwest are now signed up to our campaign pledge formally, or have made an equivalent financial commitment to care workers around sick pay, whilst Wirral Council have guaranteed the foundation living wage for care workers, which is fantastic news. And on Tuesday, after a Northwest MP, Nav Mishra for Stockport, asked a question in the House of Commons, Matt Hancock suggested that the new £600 million infection control fund for social care should mean that care workers who need to self-isolate due to COVID should be paid properly. So we know there's a big job of work to do for trade unions to monitor this locally, ensure that funding reaches the front line, but it's a huge step in the right direction. As Sarah mentioned, there's been an upsurge in union membership, so over 1,000 new social care members have joined our campaign, the union, within the first 6 weeks of our campaign in the Northwest, and we've identified a load of great new activists which are going to be crucial to getting long-term change in social care rather than crisis fighting as we're facing at the moment. So the wins that we've won recently have shown more clearly than ever the failures of the current system, and despite the significant profits of some care providers, none of our wins have been funded by private care providers, unfortunately. Every additional penny has been taken from public funds, and only where we've campaigned successfully to demand it. I think this is our moment, as Sarah's mentioned, around the kind of public mood in care, and the scale of care home deaths is not inevitable. It is a consequence of the way the system is set up. So from Unison Northwest's perspective, we will continue to campaign locally, and we're working nationally with Citizens UK to campaign for all care workers to be paid the foundation living wage. But ultimately, we have to be much more bold than that. It's not time to tinker with a broken model. We need a wholesale restructuring to genuinely integrate health and social care systems, for the social care system to be universally available and accountable, crucially, as it isn't at the moment, publicly provided, free at the point of need, with proper recognition of workers and nationally negotiated terms and conditions of employment. And if that sounds a lot like the NHS, then great, it should do. But this cannot be won from within individual social care workplaces or specific regions. We really need a national coalition to win this campaign. So I hope we can work together on it. And if you do want to follow our campaign, it is on social media as Care Workers versus COVID-19. So I'll stop now, but I'd be happy to take questions.
Thank you so much, Conor. That was great. It's amazing to hear about all the wins you've had, but also thank you for giving us an overview of the things that could be done or being calling for to improve the sector. So I'm sure everyone on this call would be really interested in what we can all do to support the campaigns Conor is talking about. So luckily we're sharing some links in the chat, so you can do just that. This will include a petition from Unison calling on social care employers, local councils and other commissioners of social care to provide adequate testing and PPE, protect pay if workers have to self-isolate, and added protections of employment and families. So yeah, we've got some questions in the chat. The first one is from Hilary. Hilary's asking, how would sick pay work for someone on a 0 hours contract? If we can have like a quick answer to that one.
Sure, it really does depend on the circumstances, but unfortunately we have seen a lot of our members in the Northwest who are on 0 hours contracts have simply seen that in the following weeks they're not rotated on to shifts by the manager, and therefore they don't receive sick pay. Locally we've tried to challenge that where we can, but unfortunately we have seen for a lot of care workers who are on 0 hours contracts, and a huge number are, a lot of them have not even been receiving statutory sick pay when they've been off. So obviously this is not the way it should be, but unfortunately it is the way it has been at the beginning of this pandemic. But we hope that the commitment of funding from government, if we can push for councils to not just pass that funding on to providers, but to genuinely hold them accountable that they're providing it to care workers on the front line, hopefully we could improve that. And that should, you know, very much definitely should include 0 hours. So, you know, if Hilary is a care worker or knows someone that's on 0 hours, I'd advise her to get in touch with her local Unison branch as well.
Great, thanks, Conor. Cool, so yeah, again, we'll come back to more questions at the end, but we're going to move on to the next speakers just to make sure we hear from everyone. Oh, actually, before I move on to our third speaker, I want to do a quick shout out to all the NEF supporters on our call. Your generosity is helping to fund our responses to the crisis so far, including supporting us to run these briefings, so thank you very much. And if you're not a NEF supporter and you'd like to become one, then please check out the new supporters network page on our website. We're posting a link to that now. Okay, great, so now we're going to hear from our third speaker. Next, we're going to hear from founder of Equal Care Co-op, Emma Back, and care and support worker, Jenny Daglish. Thanks so much for joining us, both of you. So first up, Emma, we're going to come to you. Could you talk to us about what a model of ethical social care might look like? And then after that, Jenny, if you wouldn't mind telling us what's been your experience as a care worker before and during the pandemic.
Hi.
Okay. Hi, Jenny. Okay, so I started my kind of work in social care and kind of mental health and advocacy, so very quickly met the recovery and the recovery movement, social model of disability, disability rights, and this idea called co-production, which was that people who were both receiving and giving services should be involved, is the phrase, in designing and yeah, in the way that they are produced and run. And my work involved doing a lot of writing about that and designing services that ultimately I realized weren't actually possible. Like, they couldn't really exist in the system that we have at the moment, where decisions are kind of centered in commissioning practices, they're in procurement, they kind of very much come from the local authority. When they move out from the local authority, decisions about services are made by middle management in big providers of social care companies, none of whom have really anything to do with the final product, actually, of what a care and support service finally looks like. So after thinking about this and kind of understanding that co-production as an idea came back to power, and it came back to decision making, and it came back to choice, and ultimately it came back to ownership. And that's when I kind of stumbled across the co-op movement, which thinks in terms of members rather than services. It thinks about relationships rather than kind of focusing on the individual, and kind of pointing to the whole. And I also kind of, I think Jim has mentioned in the chat, came across Buurtzorg, which is a form of decentralized nurse-led leadership services in the Netherlands. And because we're building a platform, I came across platforms. So I was kind of setting out to ask myself, like, what within the existing system that we're working in, what could change the power dynamics that exist between the people who are giving support and the people who are getting support, and all of the different actors that exist around them and push on them in different ways, like mostly managers, but also commissioners, social workers, kind of the entire edifice of social care that exists around us, and that we kind of get often a very short, sharp shock in terms of being introduced to it. So I'm going to skip out a lot, but I think it comes down to where's the work, like who's doing the work, and where's the control. So who is controlling how the care and support takes place. And at the moment, in kind of an existing agency, the work is seen as being done by the workers who are paid for it, but is less acknowledged by the family members. And the locus of control remains firmly within the hands of the registered manager of that service, as per Care Quality Commission regulations. So we've been working with a shift to that model, and mostly inspired actually by disability rights and personal budgets, as they kind of started out about 25 years ago, where the person who's getting support is the employer. Like, so they're in control, they are the manager. So like, okay, why can't we do that everywhere else? So we're working in teams where the owner of the team or the leader of the team is the person getting support. They are in control of the support, they decide, they are the ones who manage and choose their team members. They also nominate a team coordinator, which could be themselves, or it could be someone else that they trust and who's already doing a lot of that work that often goes unrecognized. So that's usually family members, or people who are kind of close to the situation. And then they employ or they choose independent care and support workers, who become team members. And so that's kind of the unit, as it were. So the locus of control is kind of sitting within those teams. It's not out to the registered manager. We have facilitators that are there to kind of hold the caring relationships that exist within those teams. So this has kind of moving away from this idea of person-centeredness to relationship-centeredness, and going, if the relationships are healthy, then the care and support will be healthy, rather than focusing solely on the individual, which often means that there are kind of various issues and with doing that. That means that you ignore the rest of the systems going on around that person. so kind of what does that mean? It means that we like offer training and support to teams as a whole. It means everyone gets access to PPE, and it means that kind of we're acknowledging the real work. We're also, through using the platform, able to pay, it's around £14-15 an hour that independent care workers are getting for their work at the moment. Still work to do on that, I think. That's still not good enough. So we're, yeah, it's all very early days. Like, we're very new. We've only existed for around a year and a half. But what we're kind of already seeing is that by being a cooperative, by focusing on a platform, by using these kind of different ways of making decisions, so we work to this thing called sociocracy, which is a way of making decisions in circles, which I'm not going to go into. But by doing that, it means that relationships with peers get prioritized over relationships with like the manager, or with or between the organization and the individual as a whole, which we're seeing a lot with other kind of gig type platforms that are wealth extracting and profit extracting. We've, yeah, just with coronavirus, so most of our independent care workers are newly self-employed, so that's not wonderful. So we're still small enough to have been eligible for the £10,000 business grant, which we're using to seed fund a bread fund, which we're co-designing at the moment to pull together. I think that's about 3 minutes, Jenny. So I'm gonna get over to you. Yeah, Jenny's a member of several teams, and yeah, can tell you about her experiences so far with the emerging thing that is Equal Care Co-op. Check.
Great, thanks, Emma. Yeah, Jenny, if you wouldn't mind telling us about your experience working as a care worker, both before the pandemic and during.
Hi, yeah, can you hear me? Yeah? Oh, great, thank you. Yeah, my name's Jenny. I've worked in the past in the NHS and in local authority, and for the last few years I've worked in a private care company. I do what's called domiciliary care work, which means I work in the community. I go into people's homes, either on my own or as part of a team, and we help people with every aspect of their life, really, from kind of practical things, getting out of bed, medication, washing, dressing, getting people food. And in the last few months, I've also started work as a care and support worker with Equal Care Co-op with Emma. And I think the reality for most care workers before the pandemic was exactly how Kira and others have described it, was really, we are almost entirely, the care sector is the main problem, I think. The care sector is almost entirely run by private care companies. It's been almost entirely privatised, which means there are thousands of competing companies that operate like any other group of competing private care companies, which are about making profits. And that means if you work for them, you are on extremely low pay, you're treated appallingly, you're in insecure work. The vast majority of people in care are women, often part-time, often on 0-hour contracts. So it was pretty bad before the pandemic. During the pandemic, I mean, I watched the pandemic and sort of witnessed it and was part of it with growing horror and fear, because the reality for most of us, the terror was we would end up passing on the virus to exactly the people that we care for. The people that I work with have got often 6 to 8 care workers going through their home, sometimes from different care companies, sometimes a number of different carers, when actually the numbers could be and should have been reduced. Because you have different companies working and often competing with each other, and people are relying on different companies or different individuals, that was a complete nightmare in terms of potentially spreading the virus. The same is true of care homes. Often people are working through several different care homes or working over several different sectors. So that completely dislocated way of working was dangerous. The lack of PPE Government guidelines were very poor in terms of what PPE people needed. People often didn't know what they needed or what they were entitled to, and often didn't have access to it. Many of us ended up buying our own PPE. I'm very lucky in the co-op in that we were provided with adequate PPE, and that's never been an issue. But for the vast majority of care workers, that's been one of the single biggest issues. And the other one has been the fact that people haven't had sick pay overwhelmingly. That's absolutely huge, because it's forced people to work when they were ill sometimes. And it's meant that actually, you know, it horrifies me, the number of deaths that have happened in care homes and in the community. I think it's a total national outrage, to be honest. It shouldn't have happened. It's still happening. It hasn't stopped. And I think it raises very fundamental questions about how we go forward. It can't go back to how it was before. It's lifted the lid, I think, on the problems within the care industry. I've had coronavirus. I've had far too many friends that have had it, that have been very, very ill, and we've watched people we care about become infected. And for me, I think the future has got to be very fundamental change. I love being part of the cooperative. I also think we do need an integrated health and social care system. It has to be, whether that's part of the NHS or whether that's part of local authority, or how you organise that, I don't know. But I think the most important thing for me is you take the profit motive out of care. Fundamentally, it has to be about the people who receive care and give care have to have some control over that process, have to be the main people who drive that process, to control what happens within that process. That's really what people want in care. They want to be respected, listened to, they want to have control over what happens to them and about who gives the care. And that is something that's just taken away. It's not just taken away from us as care providers and carers, it's taken away from the people who need care. They have very little say or control over any aspect of what happens to them. And their reality over the last few months has been solitary confinement, if you're in a residential care home, isolation, loneliness and fear, and sickness and death in some cases. So it leaves me feeling, I'm very hopeful about, I'm a member of Unison. I think it's brilliant how many people have joined Unison. I'm also involved in Care Workers Co-19 Action Group, which is where different unions have come together. I think there's been lots of campaigning and lots of success stories, which has been fantastic. So for me, I hope that's the way forward. Sorry, I think I've gone on too long.
That was great. Thank you so much, Jenny and Emma. Your work is amazing. And Jenny, I'm so glad to see you well again after having coronavirus.
Thank you.
Yeah, it's super inspiring to hear about both your work. Thank you so much for sharing. Everyone can find out more about Equal Care Co-op by checking out the website. We're just going to put a link in the chat right now. I just wanted to say we also appreciate that there are lots of people in the chat sharing their experience of loved ones receiving care at the moment. Thank you so much for doing this, and it really shows how many people are going through difficult times at the moment, and we're sending solidarity to all of you. We're going to move on to our final speaker now, just to make sure we don't run out of time. So our final speaker is the Professor of Economics at the Open University and Coordinator for the Policy Advisory Group of the Women's Budget Group, Sue Himmelweit. So Sue, thank you for joining us. So you've been talking about a care-led recovery coming out of this crisis. Can you talk us through what this means and why you think it's important?
Well, this crisis isn't going to suddenly come to an end. Lots of people are going to lose their jobs, not in care, but in lots of other places. And we're going to need government spending in order to boost demand. What I think is really important is that spending then isn't on on harmful things that we don't need, but things that we actually do need. And good care for people, for children, and NEF's also done some very useful work on childcare, and of course for adults too. But what we've also learned from this crisis, and some of us were aware of this before,
It looks like we might have lost Sue's connection. she's back. You're back.
What was the last thing I said?
I think you said, oh, gosh, that shows me up, doesn't it? I got so distracted by you cutting off.
All right, I'll go back. I'll just back a little bit.
Sentence, maybe.
Yeah. All right. We found out from the pandemic how dysfunctional our social care system. You know, it's coped particularly badly because of inherent structural problems in the way that a privatized system works. And other people have talked about this, but I'd like to stress how particularly a privatized system is particularly bad for delivering something like care. It can have problems in delivering other things too, but for care, it's really hopeless. And it has been recognized for some time as a system in need of reform, at least of its funding. But actually, we need far more than that. We need to rebuild it from the start. And lots of the other speakers have said that. And what I'd like to argue is that we'd start talking about a care-led recovery program. So it would be one that would take social care and rebuild it. We will need, anyway, to boost the economy with stimulus spending. And work that's done through the Women's Budget Group with Jerome Bernal showed that if you compared the effectiveness of spending on care with spending on construction, and if you remember, construction, when people talk about stimulus spending, they usually mean building a bridge or an big physical infrastructure project. But if you compare how effective every pound that's spent on one or the other, and you take account of all the jobs that are created, both the jobs that are created directly, those that are created indirectly by the other industries that feed into whichever industry you're spending your money on, and then the induced jobs that come out of the workers that have been employed in these industries spending too, you add all those together, you get roughly, for the UK, twice the number of jobs created by spending on care as you would get from spending on construction. So it's a very good candidate for stimulus spending, for a care, what I would call a care-led recovery. But we also know that the social care system needs transformation. And any reformed care system, in many of the ways that people have talked about, will, among other things, it will need better training for care workers, a better career structure for them, and better pay. Some of these things we can't model in the same way that we could calculate those numbers of jobs, but we can look at, could we pay care workers better, and would we still get so many jobs? And the idea of paying care workers better now, this is the moment to do it because there clearly is popular support for it. So we need to draw on that popular support. And our analysis, this is some new calculations we've done very recently, shows that even if you paid care workers much better, roughly if you doubled their wages in this country, you, compared with construction, you no longer get twice as many jobs. You wouldn't increase the amount by 100%, but by 70%. So you would still get a lot more jobs than if you spent it on construction. But that isn't looking at actually what do we need? What sort of care system do we need? So another way we could look at this is to say, well, what if we became more like Denmark? We could take that as a good example because it's a place where care is seen as a skilled job. So if the UK became more like Denmark as a country, so it spent as much as Denmark does on its care system, again, both children and adults here, and we paid care workers as well in relation to their average wage as in Denmark, we would then employ twice as many care workers as we currently do. There would be in our economy twice as many people spending their employment time on being care workers as we have now. And that would raise the care workers in the workforce from, they're about 6% now to about 12%. And it would also, through the process I talked about before, generate jobs in other sectors. So raising employment by about 1.6 percentage points. So in total, a 7.6% point reduction in the unemployment rate. That's a big jump in employment. And that's the sort of thing that will be needed to get people back into, to get the economy running, people back into employment. And as well as that, that will be a sizable rebalancing of the economy towards more caring jobs. And of course, they are also greener jobs. Care job, spending your time looking after people is about as green as you can get. So I would like us to see us talking about a care-led recovery. We could see this as not subsumed under the Green New Deal, because people who advocate the Green New Deal do often talk about spending more on health and social care. But I think we should see it as an addition to it, an equal partner, if you like. So we could see it perhaps as a green and caring New Deal. Okay, that's it.
Great, thank you so much, Sue. It's really good to end the call on what a better future might look like. We're going to put some analysis from the Women's Budget Group in the chat now. We're really almost out of time, but we've got a question for you, Sue, if you could keep your answer really brief. It's a question from Gillian Bird, and the question is, how can market economics be applied in a caring culture?
Do you mean to analyse a caring culture? Well, one of the things that even by standard economics you would find out is that you can't really treat care as a commodity like any other. But one of the reasons you get this huge race to the bottom in terms of conditions in the care sector is because if you start applying competition to it, it's very difficult to judge quality from outside. You can set up all sorts of scales, tick boxes that have to be applied. But when you're actually talking about the quality of relationships, that's very difficult to assess from outside. And as a result, what you end up getting is competition only on price. So care homes feel that what they have to be really competitive is on price. And the only way, because care is almost entirely, it's extremely labor intensive, nearly all the cost is the cost of the care workers. The only way to cut costs is to take it out on your workers. And so in that sense, I don't think the profit, as somebody else has said, the profit motive doesn't sit well with care. It's not so much the profits go out of the care industry to the people who make the profits, though that's a pity too. But the main problem is what the care motive does. So in fact, you do have some very good care homes that are run on a profit-making basis, but they manage to be good care homes despite having to make a profit, not because they're part of a profit-making system.
Great, thank you so much, Sue. It's great to have your expertise on the call. That was really, really good. So thank you for joining us this evening, and thank you to all our speakers. Just to wrap up, over the next few months, NEF will be exploring the question of how we can build a more universal, decentralised social care service with higher standards, including a new deal for care workers. We'll be engaging lots of groups and organisations, including disabled and older people's organisations, trade unions and social care providers. So please do get in touch if anyone is interested in getting involved. You can send an email to the address we're posting in the chat now. So unfortunately, that's all we have time for this evening, and it's the end of this series of the weekly economics briefings. Thank you to all our speakers again, and thanks to all of you for coming this evening, and to anyone who's attended any or all of the briefings. We are going to take a break over the next couple of weeks, but we will be back again soon. So please do make sure you are signed up to our mailing list to ensure you hear from us again. That's it from us. Stay safe and see you soon.